area that is not much spoken about. There is always an element of fear when it comes to healthcare. So I want to directly start by asking you, in building a healthcare for 1.4 billion, how does Apollo really come into the picture? What exactly is the roadmap for building healthcare for 1.4 billion?
So thank you. First of all, I'm extremely happy that healthcare has become so much center stage and these kind of questions are being asked. When we began 42 years ago, the primary thing was we were driven by the vision and the need to bring advanced healthcare which was being practiced in the West and bring that to India at a price that people could afford it or even give the access. So in 1983, we started our first hospital. Dr. Reddy, our chairman, was a practicing cardiologist, came back to India, and he used to practice cardiology, but he sent his heart surgery patients to the US because the cost of care was unacceptably high. And the other problem was really that the outcomes were not the same in India. So he said, if Indian doctors can cure and heal people all over the world, why can't we do it here? He set up Apollo within, and it was not easy. There was no support from banks, very limited, support from the government. But he persisted because he felt this was, the need. But from that time, so after our first hospital became a success, then, history has shown today we're over 72 hospitals, over 10,500 beds. But more importantly, we're delivering that world-class care at 1/10 of global prices. And in the journey of the last 42 years, we've worked on health insurance to enhance access. We've worked on medical skilling with 2 medical colleges and almost 17 nursing schools and one of the largest online training platforms for paramedics. So we've worked on different areas, on science, on research, on discovery, on prevention, the pharmacy chain, customer connectivity, AI in healthcare. But now I think the biggest thing that we are really working on is prevention. And this is not something we've done today. We've been doing preventive healthcare or the health checkups for the last 25 years. And even earlier. But today, when you come into an Apollo health check, we start with an AI-enabled risk score. We do a personalized set of tests. We then move this into not a prescription, but a path to wellness. And I think this path to wellness, which is supported by a health mentor, is really the transformational way to look at healthcare. And so, coming back to at a national level, I believe that Apollo has validated models that I hope can get scaled by everyone. It's in infrastructure, it's in preventive healthcare, it's in methodologies of education, it's in social impact. We've worked with governments in primary healthcare. We've done programs like Kanti Velugu, where we screen about 20,000 people a day for eye problems using AI and technology and issue approximately 2,500 spectacles a day. So it's in programs like that at scale. So in joint ideation of mission mode interventions to create true transformation in the healthcare of our country, accelerating known good models and bringing this forward and creating this positive flywheel. Because when you focus on prevention using data, you will then create the data capability for innovation and you will reduce the burden of disease because the cost of care comes down with prevention. Once you've done the innovation piece, you will come up with new methodologies, new cures, like new vaccines, new biomarkers. And this will become a positive flywheel which can transform the healthcare ecosystem of our country. So while we're working every day, we see about 300,000 patients a day, either physically or digitally. We're working at a practical level every day. We're visioning for a much healthier, happier country.
Well, I think so many in this particular auditorium would have also witnessed it. You speak about preventive medicine and the fact of Fact of the matter is that when we have actually gone into a hospital in today's time, and especially in a market which is profit-driven, we're largely told that, okay, why not go in for a surgery? And that's not much of a, not much of a focus or an impetus that is given on prevention. Do you think that is going to change given the fact that there is a lot of competition in the health industry too?
So I'm not putting it in the context of competition. I'm sure it's going to change, but I think the driver for change is going to be people like all of you, that you understand healthcare. You begin to realize that the heart attack that people are getting, and many young people are getting heart attacks, but the heart attack that you're getting at 50 began by the arteries getting clogged at 25 and 30. And that's when the negative began. The fact that you have a stroke when you're 70 is because of something that you didn't do when you were 50 or 60. And definitely the disability at 80 happens because of the muscle wasting which began in your 60s. So this appreciation that so much of staying healthy is in your own hands, and so much of monitoring that health is in proactive preventive healthcare in a good scientific environment. That, I think, is the basis for the transformation which is going to happen. And that's what we are working on public awareness, on proactive, preventive, predictive healthcare using all the diagnostic tools and AI, and definitely on a deeper connect, creating digital twins, creating solutions where we can monitor people's health and help them be proactive and healthier. Our chairman's vision now is very clear. I want health and happiness at home.
Dr. Reddy, I want to share this with you because we've had this personal experience many a times. For example, from a place where I come from, access to healthcare was extremely difficult, even till date. I think so Napola has just come up a few months or a year back, that is in Shillong.
Where do you come from? Shillong. Okay.
And for the longest time, we had to travel far away to even reach. And Apollo at that point in time was like, if I have to go to Chennai, all the way. So you would have a lot of people from the Northeast actually going there. Accessibility is still a problem. Till date, this conversation happens in remote areas that we do not have access to the kind of healthcare, say, many of us really enjoy in urban cities. Is there a possibility when we really talk about Viksit Bharat, can a Viksit Bharat actually happen when access to healthcare is such a big problem even till date?
So a Viksit Bharat can happen, should happen, and will happen. The accessibility to healthcare is a problem that must be solved. First, I must thank the people of Shillong in the Northeast. They have put so much faith in Apollo and come and travel to us, so we're now trying to get closer to them. But let me just say that today, healthcare is accessible via telemedicine at the first stage. So one of the things I'm seeing as a global trend is that healthcare is moving from the hospital into the clinics, from the clinics into the home, and from home into a 24/7 ubiquitous access to care. You can pick up your phone, download, whether it's Apollo 24/7, you will see a doctor in 15 minutes. These are the kind of things where technology is being used. The government telemedicine portal, extremely powerful platform with many, many doctors connected. So number one, for teleconsults and initial understanding of health problem, people do not have to travel. We must educate public to use technology to at least understand their problems first. The second step then is, how far do we need to go for diagnostics? And diagnostics again are moving to small village headquarters. In fact, we've done many partnerships with primary healthcare centers to put it there. And then there's the proliferation, hopefully, of more private hospitals and the upgradation of general hospitals and the government hospitals. So my belief is that healthcare is getting closer. My hope is that preventive healthcare is going to become a larger theme, and that public are becoming more aware about their health and will proactively manage their health in a different way, and that the burden of disease in our country will come down because early detection and prevention is far more powerful, less painful, and much less expensive than going in for a high-end surgery. This is the primary message of healthcare today.
Yeah, I want to also focus a little bit about the journey that your father has also had, the letter that was written by your grandfather to your father and thereafter asking him to return and perhaps start something here in India and contributing to the growth story. The difficulty that your father had to bring the kind of quality doctors. Today, numbers may have increased. The number of doctors that we have may have increased. But do we really have the quality? Are we really at a situation where we do not have enough quality doctors? I'm not talking about urban areas. My focus is largely for those who still feel that good quality treatment is not available to us.
So you hit upon two very important points. Number one is the availability of doctors. I will enhance that to say doctors, nurses, paramedics. Not only do we still have a shortage in terms of ratio, but we must acknowledge the fact that the number of medical colleges has actually grown exponentially. And the number of graduates that in the next 5 years we will be bringing out, it's estimated that in 12 years we will no longer have a shortage of doctors. But the second thing is that the way and the productivity of doctors is going to enhance using AI. But the other trend which is happening is that many of our doctors and nurses are traveling abroad. And many of our paramedics are now working in non-clinical areas. I know an X-ray technician who says he makes more money working as a Swiggy delivery boy than as an X-ray technician. So there is a cost and a remuneration gap which also we have to solve in terms of financial structuring. But the big point you made was also on the quality. And here I think there's more that we need to do. Indian doctors gained an amazing reputation across the world because of the extent of training. In fact, in Apollo, we have a global partnership with an international university, and their students spend 6 months of the year with us because of the quantity of work and the quality of the training that they can get. But we need to ensure that all our medical colleges are of that standard, and then we need to train them in new age treatments. So artificial intelligence is not yet a subject in the medical curriculum. That has to happen immediately. Robotic surgery, which is clearly going to be part of the future. Stem cell therapy, preventive healthcare. But I know that the Medical Council is looking at these. I have great faith in the capability of the Indian clinician and of our ecosystem to evolve towards that vision of Viksit Bharat.
Dr. Reddy, pardon me by saying this, but I think so many would, at home would have spoken about this, that most of these hospitals today have these preventive healthcare facilities, checkups that are being done. And when you have a conversation back home, they'll say that, okay, look here, this is more that the hospital is trying to extract more money out of us. So preventive healthcare also has this notion that this is again some sort of an activity or carried out by the hospital, which is again PR driven, does not have much of a benefit, and it does not really work. So what would you essentially tell those that does this really help? Does this kind of express checkups that we have, hospitals have put up, does that really help anyone?
See, an appropriate health checkup done in a right place with a good medical interpretation is invaluable. Let me reiterate this point, that if you find that your cardiac vessels are beginning to have a block, if you change lifestyle, if you change diet, if you control the identifiable risk factors, and if you prevent your heart attack, isn't that extremely valuable? Because when you have a heart attack, that vessel gets blocked, your heart muscle gets damaged. This is irreparable damage. So because of a few things which have happened in a certain center or a certain commercial practice happening in one center, don't deny yourself the power of a good health checkup. That's the only thing I would really say, because your future depends on staying healthy today and doing the right things to keep your body working tomorrow. Today we're talking about longevity. I will say that our effort is not just towards longevity. It is towards creating health span versus lifespan. So in your 80s and 90s, can you walk? Can you do things yourself? Do you need major treatments? These can be prevented by having a health checkup today. And then, like I said, it's not about a prescription. It is about a lifestyle which becomes part of you, or a journey to wellness. Bring yourself to the optimal level of wellness. That's what Apollo Pro Health does. And I really hope wherever you're getting your checkups, that you are looking for a proactive, preventive health initiative in your lives.
Are we as a society much more afraid of getting a diagnostic done because we would be essentially told that we have a trust deficit here, because no matter what we do, we would be told that there is something wrong whenever we go to the hospitals. Can that trust deficit be, can we bridge that gap?
I think I need the help of media to bridge that gap, because I truly believe that if you walk into, we do approximately 2.5 million health checkups every year within our ecosystem. And I know that out of every 1,000 checkups that we do, we find 11 people with major problems. Cancer at the early stage, heart disease at their early stage, preventable stroke, liver, that you could find. And when you treat them at an early stage, I reiterate, it is less painful for them and their family. It is more cost effective, but more importantly, the outcomes are better. So why in India do we have 65% of our cardiac diagnostic treatments resulting in interventions? Because they're coming so late. Where was that patient when his first vessel was getting blocked? They're coming with 3-vessel and 5-vessel disease. And 72% of our cancers are over stage 2. Where was that person in stage 1? This is the question we have to ask ourselves. So please find the right place that you trust, but don't deny yourself the power of a health checkup. That is really the important message.
Dr. Reddy, there is always a dichotomy here because...
Thank you. I really think that it's important for all of you. Thank you.
So I think so when they go back home today, everyone can actually feel rest assured that once you go to the hospital, need not be that you'll have to be told that there will be a surgery.
Yeah, it's not. Sometimes, your repeated headache is because you didn't get your eyes checked and you need to change your glasses, or you need glasses. Sometimes it's an ulcer because you haven't had food on time. And that ulcer could have become something much bigger if you don't prevent it now. So this early warning symptoms, that the human body is an amazing mechanism. It's telling you things every day. And medical science is an amazing science which is also picking up these signals. So allow these two to work together for you, to keep you healthier, to keep you at optimal health.
There's a dichotomy here because many would say that if I go to the hospital, I spend much more. Many of it, like an outpatient duty that is not covered by the insurance, which essentially means any test that you and I are doing, they're quite expensive. An MRI today would have been costing us a lot, which is not covered. What really happens then? This comes at a time when we are basically projecting ourselves as India as the global medical hub. But the reality is also this, that many of us still cannot afford because our insurance does not allow that. Today, here in the national capital, when you have respiratory illness, you have insurance companies speaking about 10 to 15% of a hike in the premium. What do we really do? How do we exactly perhaps turn this over?
So number one, I think you raised a very beautiful point, which is I firmly believe that health insurance should cover outpatient as well as inpatient. Very few people know this, but in India, insurance is sitting in 3 verticals. It's in health insurance, it's in general insurance, and it's in life insurance. I had the privilege of deposing in front of the parliament when the insurance bill was being discussed. The power of having it in life insurance is that the life insurance people will spend the money on preventive healthcare to keep you healthier longer. We should not think about health the way it happens in some Western countries as per member per month. That is not health insurance. But coming to the main point, number one is we need coverage for OP and IP. The second important point is that there are clear protocols of what is the appropriate healthcare that is needed for a person. And there are clear indicators. When do you need an MRI and when do you not? And so it's easy for all of you to educate yourself on the appropriate protocol and very confidently ask your doctor saying, I don't need to have this test, I'll come back later. But don't miss out on the essential things. So I really would like to know how many young women under the age of 24 have had their HPV vaccine. Do you know that having this vaccine can prevent you from having cervical cancer? These are the important things we need to ask. How many women over the age of 55, how many men over the age of 55 are having their cancer screening? It's a simple test with no cost to have a prostate exam. So these are important things. My request to everybody is to become aware, do your diagnostics. So, at Apollo, we're really putting so much effort into saving lives, high-end intensive care, robotic surgery, bone marrow transplant, heart transplants, but we're putting equal effort into prevention, into educating public about what they need to know and what they can do to stay healthy. There's simple things. If the elderly at 50, 60, if you simply do your leg exercises, you will improve the circulation to your legs. And if you're a diabetic, that's even more important. Because imagine at 55 or 60 if we have to amputate a toe because of that less vascular flow. I want this knowledge to go to every home and every household. In the olden days, through yoga, India knew this. We lost our yoga, we lost lots of this thing, and therefore we've come in, and then we've moved to sedentary lifestyles and, the new age kind of living. So let's rediscover some of these proactively with the backing of science so that we can stay healthier.
One final question that I want to ask you, Dr. Reddy, because there is a lot of pressure and expectation from the private industry, and particularly when it comes to the health infrastructure. When it comes to the government spending, it is abysmally low. We cannot expect proper structures, infrastructure to be in the rural areas. The entire health system appears to be broken, especially given the condition of our hospitals. What perhaps can be the perfect public-private partnership that would enable us to have a better India, an India where every Indian citizen has access to good health care? What would your vision essentially be?
So let me begin by saying that I think Ayushman Bharat, the Prime Minister's insurance scheme, the enhancement of medical colleges, the enhancement of the All India Institutes, the growth of the wellness centers, there's some amazing work that is happening in the government, and I must acknowledge it. It's just that there is so much to be done. Simple statistics, 30% of the world's disease burden is in India. And less than 2% of the world's budget is being spent in India on healthcare. So number one, we need to allocate more money towards healthcare. This money must go 40% into health infrastructure, whether it's directly or through PPP. The second, another 40% should go into primary preventive healthcare so that we're giving the vaccines, we're creating mission mode like the Prime Minister's amazing program on Eliminate TB. So we need about 7 to 10 initiatives on things like that. And hopefully another 10-20% could go into public education and research and innovation. Because we have the data, we have the brains, we have the capability. Let India bring cures to the world rather than only adopting those cures. And with Viksit Bharat, with many of the initiatives on PLI, we are on the track. I think we need to accelerate that track. And I would just say that the private sector is ready. The government is also working hard. If public also come into this equation, together we can create a healthier and a happier India. But it is important for this to be high up on the national agenda. Because as we're becoming an economic superpower, as we move to, fourth place to third place, can we enjoy that wealth if we don't have the health? So please, let's put health high up on the agenda for every home, for every individual.
Thank you very much. Thank you very much, Dr. Reddy. It was a pleasure speaking to you. I'm hoping that the awareness that you essentially want, it reaches to every home, every household, and hopefully we are a healthier India.
Absolutely. Look forward to it, and thank you very much. I want to end by saying that our vision is really that we can heal in India because people from all over the world, from 140 countries, they come to us for care. So have that trust factor. If the rest of the world is coming here, there must be something good happening in Indian hospitals. The second is heal from India. We can create remote care. We have the doctors and the nurses. And the third is heal by India. Our young people with our positive demographic, there's a 17 million shortage of healthcare professionals across the world. India can train and help to fill that gap. So there's a tremendous future in the health sector. Let's get together and make it happen. Thank you.